My name is Victoria Tomczak, and I'm the nurse navigator for the stroke program at Hoag Hospital. And I'm going to speak to you today about how to prevent a stroke. And if during my presentation you think of any questions you'd like to ask, you can text those in the chat box, and then I'll be happy to answer all your questions at the end of the presentation. So when we think about stroke, we want to be stroke smart. We want to know the 3 R's of stroke, and that's to reduce our stroke risk, to recognize stroke symptoms, and to respond at the very first sign of a stroke by calling 911 immediately. And I'm going to give you a little more information about how we can achieve the 3 R's of stroke. So first, I want to tell you and explain to you what is a stroke. A stroke is a brain injury. But it's not an injury that occurs because you get in an accident or fall or something hits your head. This is an injury that is caused when a blood vessel to an area of the brain becomes blocked or it bursts, and it cuts off blood flow and oxygen to an area of the brain, resulting in what we call a stroke. So there's 2 kinds of stroke. The first is an ischemic stroke, which is caused by a blockage of a blood vessel. And that's a majority of all strokes. About 87% of strokes are ischemic. The other kind of strokes are hemorrhagic, and those are caused by bleeding in the brain. So a blood vessel leaks in the brain, or an aneurysm ruptures and there's bleeding around the brain, and that's about 13% of all strokes. So this image just shows us that by the symptoms that you'll have related to a stroke are determined by the area of the brain where the stroke occurs. And if you look at the image on the left side of your screen, it's showing you the major blood vessels to the brain, and the vessel where a majority of strokes occur are in the middle cerebral artery. And so if you look at the image on the right, that's where all that colorful stuff is. The green, the red, the purple, the yellow. That's the territory that's most commonly affected by a stroke. So that's what's going to give you the speech problems, comprehension problems, language problems, arm and leg weakness, and we're going to talk a little bit more about each of those things. So a stroke is a brain attack. Sometimes people think that a stroke occurs in the heart, like a heart attack, but this occurs in the brain, so we call it a brain attack. And approximately 795,000 people every year will have a stroke in the United States. Stroke is the number 5 cause of death in the United States. And my screen just went blank. And about every 40 seconds, someone in the U.S. is suffering from a stroke. We're having a little bit of technical difficulties here. Okay, so if you look at this picture of the map on the right side of the screen, and I put a little arrow down where Orange County is, but you'll see that area that has the dark purple area. That's the region of the country that has the highest mortality rates related to stroke. So along the south to the southeast, and we're not exactly sure why that occurs, other than it could be a lot of familial risk factors, because families tend to stay in that same area of the country. It could be dietary related, cholesterol levels, high blood pressure, but we just know that that area of the country seems to have higher mortality rates from strokes. And we kind of sometimes refer to that as the stroke belt of the United States. So every 40 seconds, someone in the U.S. suffers a stroke. But we know that about 80% of strokes are preventable. So there are certain risk factors, including heredity, age, and race, that we can't change. But there are several risk factors that can be changed, treated, or controlled to prevent a stroke. So it's best to talk to your doctor about what your stroke risks might be. So I'm first going to talk about the stroke risk factors that we can't change. And my screen went blank again. The first one being your age. We know that as we get older, our risk of having a stroke nearly doubles every 10 years after the age of 55. And although strokes seem more common among the elderly, a lot of people under the age of 65 also have strokes. In fact, anyone can have a stroke, even children. A family history of stroke can raise your risk. So if your parents, grandparents, sister, or brother has had a stroke, especially if they were a younger age when they had the stroke, younger than 65, that could mean you're at greater risk of having a stroke. Race can make a difference. Statistics show that African Americans have a much higher risk of death from a stroke, and Hispanics and Latinos also have increased risk factors for stroke. Our gender can affect our risk for stroke. So each year women have more strokes than men, and stroke actually kills more women than men. And did you know that twice as many people die from a stroke than die from breast cancer? And the risk factors associated with being female are pregnancy, history of having preeclampsia or eclampsia, gestational diabetes, oral contraceptive use, especially when it's combined with cigarette smoking, and postmenopausal hormone therapy are all risks that increased risk factors for women for having strokes. So about 1 in 5 women will have a stroke. And about 55,000 more women than men have a stroke each year. And up until about the age of 65, actually more men than women have strokes, and then it flips, and as we age, more women than men have strokes. So having a prior stroke, a TIA, or a heart attack can also raise your risk of having a stroke. So a person who has had a stroke has a much higher risk of having another stroke than a person who has never had one. Transient ischemic attacks, also called TIAs, are a strong predictor of stroke. TIAs are smaller temporary blockages in the brain that can produce a milder form of stroke-like symptoms, but they don't leave permanent damage on the brain. And those symptoms usually resolve within minutes to a few hours. If you've had a prior heart attack, you're also at higher risk of having a stroke. A heart attack is usually caused by plaque that builds up, causing blockages in the blood vessels to the heart. And similarly, most strokes are caused by buildups of plaque in the blood vessels to the brain. So now let's talk about some of the stroke risk factors that we can control, we can treat, and improve. The number one leading cause of stroke all throughout the world is high blood pressure. So manage your blood pressure. When your blood pressure stays within a healthy range, you reduce the strain on your heart, the arteries, your kidneys. That helps keep you healthier longer, and it also can decrease your risk for stroke. And a normal blood pressure is below 120/80, and that's according to the American Heart Association. So it's good to know what your blood pressure is, and if your blood pressure is high, what to do about it. So if you have a normal blood pressure, the recommendation is to continue to live a healthy lifestyle, make good lifestyle choices, diet, exercise, and get yearly checkups with your doctor. If your blood pressure is mildly elevated, it's recommended that you make changes to a healthy lifestyle. You get reassessed in about 3 to 6 months with your doctor. If your blood pressure is much higher, so anytime it's above 130 to 139 on the top number and over 80 to 89 on the bottom number, it's recommended that you have a 10-year heart disease and stroke risk assessment with your physician and make lifestyle changes that are healthy, and then follow up with your physician, and you may require medication and treatment to control your blood pressure. And if your blood pressure is over 140/90, that's very high blood pressure, and the recommendation is that you follow up with your physician frequently, have monthly follow-ups until your blood pressure is controlled, and blood pressure that's high like that may require more than one agent to get controlled. You may be on 2 or more different types of blood pressure medications. So when you're going to get your blood pressure checked, you want to be in a good state. You don't want to just do it right after you've been exercising or when you're under high stress. So you want to take a few minutes and just kind of relax before your blood pressure is checked. Sit still and then have your blood pressure checked. During the blood pressure check, it's a good idea just to sit with your arms supported on a table or on the arm of a chair. Don't move around a lot and don't talk while your blood pressure is being checked. So a lot of times when you'll go to the doctor, they'll put the blood pressure cuff on, they'll start checking your blood pressure, and then they'll stick the thermometer in your mouth. Well, that's a good way to make sure people aren't talking while their blood pressure is being checked. And then after your blood pressure is checked, sometimes it's good to get a second reading to make sure you're getting the same reading a couple of times. And sometimes they may take your blood pressure 3 times and take an average of those pressures, especially if they're getting variable readings. So diabetes is another risk factor for stroke. In fact, it more than doubles a person's risk of having a stroke. Many people with diabetes also have high blood pressure, high cholesterol, are overweight, and this increases the risk of having a stroke even more. So every 2 minutes, an adult with diabetes in the U.S. is hospitalized for a stroke. So you need to work with your doctor to manage diabetes, and therefore you can reduce your stroke risk. High blood cholesterol is also a risk for stroke because that's what leads to those blockages that can cause heart attacks and strokes. So how we improve our cholesterol is, number one, it's good to have your cholesterol profile checked with your doctor so you know where you're at. And then follow a good healthy diet. So we say a heart healthy diet. So that's a diet that's low in fat and cholesterol, a diet low in sodium, and not too much excess sugar, because all those together can lead to high cholesterol levels. So especially you want to watch your diet for any saturated fats or trans fats, because those really raise the bad cholesterol. Some of the fats are good for us though, like olive oil, the monounsaturated fats. Those actually help our body by picking up excess cholesterol out of our blood system and taking it back to the liver to be processed. Eating a vitamin-rich diet with fruits and vegetables can also help lower our blood pressure, our blood cholesterol, and improve our brain function. Physical activity. So if you're physically inactive, start moving and be more active. And I know some people have physical limitations, but we want people to be physically active within any limitations they may have, because physical inactivity increases your risk of stroke, heart disease, being overweight, developing high blood pressure, and high blood cholesterol, and diabetes. So daily physical activity increases your length and quality of life. So go on a brisk walk, take the stairs instead of an elevator, do whatever you can to be more active. And try to get at least 30 minutes of activity on most days. That's the recommended amount of exercise, at least 5 days a week, from American Heart Association, and the ADA recommends that too, the American Dietetic Association. Maintaining a healthy weight can help prevent stroke. So if you're overweight, take steps to get your body mass index into a healthy range. Excess body weight and obesity are linked with an increased risk of high blood pressure, diabetes, heart disease, and stroke. So can you see how all of these things go together, increasing our stroke risk? So by taking these steps, we can decrease our stroke risk. Tobacco. Don't use tobacco. Smoking, vaping, or smokeless tobacco. Recent studies confirm that cigarette smoking is a crucial risk factor for stroke. The nicotine and carbon monoxide in cigarette smoke, they damage the blood vessels and pave the way for a stroke to occur. And that goes the same for vaping, because most of those vapes have nicotine included in them, and those are doing the same damage to the blood vessels as smoking a cigarette. Atrial fibrillation is an irregular heartbeat, so sometimes it's referred to as AFib, and it causes the upper chambers of the heart to quiver rather than beat in a nice rhythmic organized manner. And this increases the risk of stroke by 5 times, because that fluttering in the top part of the heart can cause blood to pool, and when blood is pooled or not moving, it forms clots. And then the heart will beat normally, and those clots can travel to the brain. So if you do have AFib, know your stroke risk and work with your doctor to lower your risk and get the right medication treatments for your AFib. Carotid artery disease. So the carotid arteries in your neck supply blood to the brain. And a carotid artery that's narrowed by fatty deposits from atherosclerosis, which is a plaque buildup in the artery wall, and it can become blocked by a blood clot. And because it's located so close to the brain, carotid arteries may more easily cause a stroke, but any artery disease can contribute to a stroke. But the carotid arteries are the 2 major ones that come up the sides of our neck, and they provide blood flow to a majority of our brain. So if you have carotid artery disease or other artery disease, you need to work with your doctor and get treatment to lower your stroke risk. Good hydration. Dehydration is linked with inflammation, artery stiffness, blood pressure regulation, and other factors that can raise the risk of heart disease and stroke. So drinking water throughout the day is one of the most effective things that you can do to improve your health and well-being. So drink more water. And if you drink alcohol, do so in moderation, because alcohol can be very dehydrating. So according to U.S. dietary guidelines, people should limit their alcohol intake related risks by drinking in moderation, meaning less than or equal to 1 serving of alcohol per day for women, and less than or equal to 2 servings per day for men. And a serving is considered to be a 1.5 ounce shot of any kind of hard liquor, 1 12-ounce bottle of beer, or 1 standard 5-ounce glass of wine. So again, excessive alcohol intake is a stroke risk. Getting good sleep. Get restorative sleep. So good sleep benefits your whole body, including your heart and your brain, with effects such as improved mood, improved memory, and reasoning. And sleep-related breathing problems can increase your risk of stroke. So if you have or you suspect that you or someone that you know, your family member, may have sleep apnea or similar problems, it's important to get that treated right away. And sleep apnea is when you have periods during your sleep where you stop breathing. So many people that snore a lot can have sleep apnea. Or if you are a bed partner with someone that snores a lot and you notice they stop breathing during their sleep, it's really important to get a sleep study so that they can get treated for that. There are several treatments for sleep apnea, and that can decrease your risk of stroke. So sleep apnea hurts hearts. It can lead to heart failure, elevated blood pressure, atrial fibrillation, resistant hypertension, type 2 diabetes, and stroke. So remember, 80% of strokes can be prevented if you control, treat, and improve your risk factors. So keep your stroke risk low with regular checkups with your doctor and treatments for any of those conditions that we just discussed if you have them. And at Hoag, we have our stroke risk scorecard, and when we get back to doing our community health fairs, you can always come and have your stroke risk calculated with us. But this is just a real simple screening form that can help you determine if you have risk factors for stroke. So So be stroke smart, know the 3 R's of stroke. So reduce your risk, recognize stroke symptoms, and respond at the first sign of a stroke by calling 911 immediately. So what are the stroke signs and symptoms? If you haven't been able to prevent a stroke, we want to be able to recognize those symptoms. And when we think about stroke, we want to be fast. B stands for balance. Is there a sudden loss of balance? E stands for your eyes. Is there a sudden loss of vision in one or both eyes? F is for face. Does a person have an uneven smile? A is for arm. Is one arm weaker than the other? S is for speech. Is their speech slurred? And T is time to call 911. So again, be fast. A sudden loss of balance or coordination, a sudden loss of vision in one or both eyes. Does someone have a facial droop? Is the face numb? Ask the person to smile. If the smile's not even, it could be a sign of stroke. A is for arms, and it could apply to the legs too, but more commonly the arm. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift down, or are they not able to lift both arms? Speech, is the speech slurred? Are they unable to speak? Are they having a hard time understanding? Ask a person to repeat a simple sentence, like today is a sunny day. Do they repeat the words correctly? Does it sound normal? And if they have any of those sudden symptoms, it's time to call 911. Even if the symptoms go away, it's good to call 911 and get them to the hospital immediately. And a TIA, or transient ischemic attack. Sometimes it's referred to as a mini stroke, but I like to refer to it as a warning stroke. A TIA is a very strong warning sign that a future stroke could be about to happen, because more than 1/3 of patients who have a transient ischemic attack will go on to have a full-blown stroke. So when we have an opportunity by the TIA, which means the symptoms resolve within a few minutes or hours, we can optimize risk factors and actually prevent the actual stroke from occurring. So it's important to seek immediate medical attention if you suspect that you or someone you're with has had a TIA. And I always say it's important to call 911 because those stroke symptoms can recur quickly. So you don't want to be driving yourself to the emergency room and have stroke-like symptoms come back, or you're driving your loved one to the hospital and they have a stroke, right in front of you. That's a very scary thing. So it's better to call 911 and have the paramedics get your loved one or you to the hospital. So remember to call 911 for stroke symptoms. The sooner a stroke victim gets to the hospital, the sooner they can get life-saving treatments, because every 4 minutes, someone in the U.S. is dying from a stroke. So I just want to give a little information about stroke and COVID. Early in the pandemic, people were afraid to come to the emergency room for serious conditions like heart attacks and strokes. But according to the American Heart Association, the risk posed by ignoring heart attack and stroke is far greater than the risks posed by COVID-19 and seeking health care. And we all know now that it is safe to come to the emergency department if you're having signs of heart attack or stroke. We have screening processes in place that will separate anyone presenting with symptoms of COVID from patients who are presenting for any other reason. And stroke is a medical emergency and needs emergency care and treatment right away. So if you or someone you know or someone you're with is experiencing stroke symptoms, call 911. So what happens when EMS arrives? They're going to ask you a lot of questions, but most important, they need to know the last time you saw the person to be normal without any stroke symptoms, because that's going to help us determine about treatments that could be given, and I'm going to talk about that in just a minute. Tell them what medications the person is taking. If you have a list of the medications, give it to the paramedics so they can bring it to the hospital with them. And give them your cell phone number or the number of a family member, because the doctors are going to want to talk to them and ask questions. Okay, so the right care right away can make all of the difference. It can save a life and the quality of life. So call 911, get transported quickly to a certified stroke center, and Hoag Hospital is a certified stroke center. So when you get to the hospital, a very rapid assessment is done in the emergency room. We call that a stroke swarm, because pretty much it seems like everybody in the emergency room comes to the bedside, and things get moving very quickly when we suspect someone has a stroke. And part of that quick treatment or evaluation is that we get rapid brain imaging. So we want from the time the patient comes in the door till they're in the CT scanner is 20 minutes or less. And normally it's less than that. So this image that you're seeing on the left side of your screen is actually called rapid brain imaging. And the pink area that you see in some of those images is a stroke that's already occurring. But then you see the green. That's all brain tissue that is at risk. So what we're trying to do when we do stroke treatments is to save all that green brain tissue. And so we restore blood flow so that we can help people have better outcomes after stroke. And the image on your right, what you're seeing, that is a brain that has blood in it. So that's why we did get that rapid CT scan, so we'll know if there's bleeding in the brain right away, because that can determine what kind of treatments we need to do. So treatment decisions are made. If it's an ischemic stroke caused by a blood clot, which is a majority of strokes, there's a clot-busting medicine called tissue plasminogen activator, or alteplase. And there's also clot-removing devices that we can do a procedure to go in and actually extract a large clot that's lodged in a vessel in the brain. And that's done with stent retrievers or suction catheters. Now, if it's a hemorrhagic stroke, like that one picture I showed you that had the brain bleeding, a subarachnoid hemorrhage, which is bleeding around the outside of the brain, due usually to a ruptured aneurysm, we can do coiling or clipping procedure on that aneurysm. And if it's an intracerebral hemorrhage, which is the image that I showed you, we want close observation in the intensive care unit. We do very careful blood pressure control, and possibly the patient may need neurosurgery to remove some of the clot in the brain. So this is hemorrhagic stroke. The one on the left is the subarachnoid hemorrhage, and it shows the image where the aneurysm has ruptured, and that just floods all the surrounding area of the brain with blood. And there are treatments that we can do. We can do flow diverters that divert the blood flow away from the aneurysm to keep it from filling. We can pack the aneurysm with little microscopic coils. Or in some cases, if it's a very unusual aneurysm or very large, we may have to do surgery and actually put a metal clip at the base of the aneurysm. Okay, and then ischemic stroke treatment criteria. So this is why it's important to tell the paramedics when the last time the person was seen normal, because we need to know that. If it's within 0 to 4.5 hours, we can give the person the clot buster medicine, the clot dissolving alteplase. And that would work really well for a small vessel occlusion or a large vessel occlusion. And if the last time the person was last seen to be normal is within 0 to 24 hours, we can do a possible mechanical clot removal for a large vessel occlusion. So that's a large clot in a large vessel. We can't do a clot retrieval if it's a small clot in a small vessel. But the large vessel occlusion is going to cause the worst stroke symptoms. So the clot dissolving medicine is an IV medicine, and it goes throughout the circulation and dissolves the blood clot. It's pretty simple. The mechanical clot removal is for large vessel occlusions, and this picture on the left shows where there's a large clot in a vessel of the brain, And the picture on the right shows that that clot was removed by a stent retriever. So that catheter is fed up from the groin all the way up into the brain, and they snare the clot into the stent and they remove it. Pretty amazing. That's actually a picture of a blood clot in a stent retriever on the left. The middle image is a picture of the brain without a whole lot of blood flow. So you see the large vessel coming up into the brain, and then all of a sudden the blood flow stops. That's where that clot was sitting. And then the image on the right shows the blood flow in the brain after that clot was removed. So you can imagine how much brain tissue was saved in that patient by removing that clot from that vessel. Pretty amazing procedures. And then another way that we can remove a clot is just with some suction catheters. And this is one that we use often. It has a little introducer that can kind of break up the clot, and then they turn on this suction canister and it just pulls the clot through the catheter, and that is actually in the middle there a picture of a clot that was extracted from a brain by suction. Okay, so a stroke is a brain attack, and it is often preventable and treatable. So reduce your risk for stroke, recognize stroke symptoms, and always respond immediately by calling 911. And remember, you want to be fast when you think about stroke. So if there's any questions, I'm happy to take those. I need to put on my glasses. Oops. Okay, so the question is how to prevent stroke for a 75-year-old with high blood pressure when boarding a 14.5-hour international flight. Well, the best thing you can do is, number one, stay hydrated during that flight. People tend to not drink enough water because you don't want to have to get up and go to those horrible little airplane bathrooms any more frequently than you have to. But it's the air in a plane is very dry and it's very dehydrating. So it's a good idea to stay hydrated. And then get up and move around. If you're just sitting for, especially on a long flight, you run the risk of getting a blood clot maybe in your leg more so than the brain, but I mean, a blood clot anywhere, especially in certain conditions, could go to the brain, but the chances of that blood clot could possibly go to the lung is also another problem that can happen if you get blood clot. So move around as much as you can. Move your legs, like pump your legs while you're in your seat. Get up and walk around and stay hydrated. Okay. On AFib, supraventricular tachycardia is not AFib. That is correct. It's called SVT. And yes, it sometimes can come and go. And yeah, AFib is a different kind of heart rhythm. It's when the top chamber of the heart, so we have bottom chambers of the heart and we have top chambers of the heart. And normally the top beats, the bottom beats, top beats, the bottom beats. And it's very rhythmic. But in AFib, the top part of the heart quivers like this. It's not a nice beat like that. So when it's quivering, the blood that's in that chamber doesn't move and it can clot. Then the heart says, okay, I'm going to have a normal beat, and then it shoots the clot out. So that's how AFib is a risk for stroke. So supraventricular tachycardia is the heart is just beating rapidly because there's a focus in the heart that's telling it to beat faster. So not the same thing. So that SVT isn't a risk, an increased risk for stroke. So overweight people have more risk of stroke because they tend to have higher blood pressure. Is it because their heart has to work harder to send the blood to the extra tissue in their body? Well, yeah, being overweight is actually a risk for higher blood pressure, higher cholesterol. It increases your risk for diabetes. If we're overweight people, we tend to not move as much, so we're not as physically active. So that's how being overweight can be an increased risk for stroke. Okay. And this question says, do most strokes happen in the colder winter season? We do see a little bit of an increase, but actually strokes can happen anytime. There's not really a season for strokes, but I think during the winter, maybe we're not out and about as much. We're not as physically active, especially if you live in a cold and snowy area. You're not going out for your runs. So it can increase, but you know, stroke can happen anytime. So always watch yourself and reduce any risk factors that you have. So this question says, can aspirin help prevent a second stroke if a person has already had a stroke? Absolutely. So aspirin is one of the treatments, or an antithrombotic treatment. So we don't want the body making more blood clots, and frequently patients are prescribed an antithrombotic medicine, which is aspirin falls in that category. There's also a medication called Plavix that we use after a person has had a stroke, and that's because we don't want it helps the platelets not be so sticky so that another clot can't form and get to the brain. So yes, aspirin is definitely a secondary stroke prevention mechanism that we use for someone who has already had a stroke or a TIA. And this question says, since Hoag is a certified stroke center, does that include Hoag Irvine? So we have two different levels of certification. Hoag Newport Beach is a comprehensive stroke center certified by DNV. And that means that we can provide all stroke treatments for ischemic strokes. So we do the clot buster medicine, the endovascular thrombectomies, but we also have neurosurgery capabilities here, and we are required to have that for Orange County EMS to bring stroke patients to us. Hoag Irvine is a certified primary stroke center. So they do the clot buster medicine. We are actually doing the intra-arterial thrombectomy procedures there, but they don't have neurosurgery there. So all of the neurosurgeons are at Hoag Newport Beach. So if a patient goes to Hoag Irvine and they need neurosurgery, they're going to be transferred to Newport Beach by ambulance immediately. But yes, they are a certified primary stroke center that they get a lot of stroke patients there. Paramedics don't take stroke patients there because they don't have neurosurgery. So how Orange County is designated, there are 9 stroke centers throughout Orange County that Orange County EMS will take stroke patients to. And it's all based on location. So we have stroke centers down in South County all the way up to Los Alamitos at the very top of North Orange County. We have St. Jude, UCI, St. Joseph's, Hoag, Fountain Valley, Orange County Global, and then south we have Mission and Saddleback that are. So wherever you are in Orange County, if you have stroke symptoms and call 911, they will take you to a comprehensive level stroke center. And it's based on location of where you're at. So yeah, always call 911. And an interesting thing is that Orange County was the first county in the country to set up a system like that for strokes. We have done it a long time for cardiac care. We had done it for traumas. And Orange County got together and said, you know, we need to set something up for stroke patients too. So that was back in 2009 that system got put in place, so that we know anyone in the county that has a stroke will get taken to a comprehensive level stroke center so they can get treatment. Okay, and I think that's the last question. So thank you very much, everyone. Have a good evening.